Thank you. Good afternoon, dear professors, dear supervisors, and dear colleagues. I'm Csaba Varga, PhD student at Semmelweis University, and my PhD program is about the indications in foot surgery, especially in the surgery of flat foot and ankle replacement. I would like to achieve that the international professional results in foot surgery are widely used in clinical practice in Hungary as well. And with my scientific work, I would like to contribute to the development of professional guidelines to provide support for orthopedic surgeons with less practical experience to setting up an appropriate surgical plan. Parts of our works are the comparison of operative techniques for the treatment of adult flat foot in different stages by summarizing the result of the operation techniques according to the latest scientific papers and to clarify the role of BMI in total ankle arthroplasty. Our first project, we have started with our first project in September. This is the comparison of operative techniques for the treatment of adult flat foot in different stages. The prevalence of adult acquired flat foot deformity, like EEFD, is around 15% between the adult population, and 7 to 15% of these patients need to be treated due to the symptoms. And surgical treatment can be chosen in case of unsuccessfulness of conservative treatment, but the guideline allows multiple choice of operations. This is the flow chart of the treatment of adult flat foot in each stages according to the guideline. It can be seen that one intervention is involved in several stages, and there are many methods to choose from within a single stage. So the guideline only provides options per stages, but the type of the surgery is currently selected based on the individual decision and the experience of the surgeon. That's why our aim to compare the effectiveness of different surgical treatments for the treatment of adult flat foot in each stages. And our clinical question is the same: which surgical technique is the most effective for the treatment of adult flat foot? In our meta-analysis, the population are the patients with EEFD in the different stages, and the intervention and comparator groups are the operation techniques. Our primary outcome will be the American Orthopedic Foot and Ankle Society Function Score, International Function Score, and the secondary outcomes will be the visual analog scale of the pain and the complication rate. Our hypothesis is there is difference in the outcomes between the recommended surgical methods. And the clinical implication of our work is to choose the appropriate surgical technique in each case and to avoid the unnecessary procedures and the reoperations. We have carried out our search in these scientific libraries with this search key, and we have found 4,143 articles, and after the duplication removal and title abstract and full text selection, we have 54 articles to make the comparison. This is the state of our first project. Our second project is investigating the safety and efficacy of total ankle arthroplasty in relation with body mass index. This figure shows that the annual incidence of total ankle arthroplasty has increased quickly in the last 20 years. These are the extracts of national registries of the countries. The ankle replacement works with a higher complication rate as the hip and knee arthroplasty. The most important local complications can be seen on the slide, like septic, aseptic loosening, and wound infection. And there are prognostic factors which can lead to these complications and which can influence the success of the intervention, like diabetes, smoking, arteriosclerosis, neurologic conditions, but the prognostic role of BMI is still unclear. We have difficulties in investigation the role of BMI in total ankle arthroplasty. To detect the wound infection, we need a short-term follow-up, and to assess the septic and aseptic loosening, we need a long-term follow-up. And BMI is often part of the metabolic syndrome and is associated with other confounding risk factors. And the example shows that 2 scientific articles appeared at the same year with the complete opposite result about the prognostic role of BMI in total ankle replacement. That's why our aim to clarify the role of BMI as a risk factor for local complications in total ankle arthroplasty. Our question, does BMI increase the rate of local complications and decrease the function score in ankle arthroplasty? The population is the patients underwent primary total ankle replacement. The intervention and comparator groups will be the different BMI categories, and the primary outcome will be the complication rate, and the secondary outcome will be the function score. And our hypothesis is complications appears in a higher proportion and the function score decreases in patients with obesity compared to normal weight patients. And the clinical consequence of our work is to predict and avoid the local complications and help the selection of patients who may be required to receive ankle replacement or must be operated on with another surgical solution. We have made our search in these scientific libraries with the search key, and we have found 709 articles, and after the duplication removal and selection, we have 106 articles to make the comparison. And this is the state of our second meta-analysis. An overview about the projects. We would like to finish our first project in June and the second in July next year. And our orthopedic profession needs simple rules. Therefore, I want to close my presentation with a quote of an American computer scientist: "Simplicity is the shortest way to the solution." Thank you for attention.
Congratulations. I'd like to ask you regarding your first project. So when the diagnosis is flatfoot, and you want to do a surgery, does the surgery target the soft tissues or the bones, or does it depend on the severity?
It depends on the severity, and according to the latest studies, the best is if we combine the 2 surgical procedures. So soft tissue procedures are not enough to keep the correction.
Thank you.
Thank you for your presentation. Could you tell us what other solutions can you recommend to your patients if the total ankle arthroplasty is not feasible?
Yes, thank you for the question. If we cannot choose the ankle replacement operation technique, then we must make another operation like orthodesis of the tibiotalar joint. This procedure works with the lower complication rate, but also with a lower function score. That's why it's important to decide which patients are able to receive an ankle prosthesis.
Very nice project, very well done. Second project, introduction slides, one of the introduction slides with the graph. What is happening in New Zealand? They do 3 times more than the others.
Yes.
So what's the reason for that? And they loved it in 2010. They still love it, but you know, I mean, they do really 3 times more than the others. What's the reason for that?
It's a good question. I don't know. Sorry.
Okay. Where are we on that graph? Are we doing one for every 100,000? Do we know Hungarian data?
Hungarian data, unfortunately, these operations by us, this is 15 to 20 operations in a year. So we are at the beginning.
Okay, thank you.
So you look for the relationship between ankle replacement and body mass index.
Please.
But what if there is a kind of correlation, but this is not a direct one? But for example, ankle replacement is higher in New Zealand because they play much more rugby or whatever type of rugby, what they do there, so they have more injuries. But at the same time, I mean, the food intake increased from 1990 to 2020, I mean, like this. And then you will see a correlation between the two, but this is actually not a direct relationship. Yes. This is just happening. So how do you know that if this is direct? I mean, there are probably ways for that, but I just don't know. But this, I mean, one has to always be conscious about drawing conclusions when there are two things which may or may not relate to each other.
Yes, so with BMI, we have always confounding risk factors. So I think we should make a subgroup analysis to clarify this role of BMI. So decided it has a direct relationship with ankle replacement complications or not, yes.
Actually, I don't have a question. I just want to answer to Erős Bálint, because maybe the answer for that high line in New Zealand maybe can be found in the financial assistance by the government. So it could be an answer for that, because in Hungary the total ankle arthroplasty weak point is the financial part. So it could be a reason for that. Thank you very much.
Thank you.